Hi, everyone. I'm Diane Macedo. Thanks for streaming with us. The White House COVID response team is set to give an update on booster shots in just a few minutes. And later today, President Biden is set to deliver remarks on that topic as well. The country's leading health officials are expected to announce that beginning September 20th, fully vaccinated Americans should start getting booster shots 8 months after their second dose. This is the latest CDC forecast predicts the number of COVID hospitalizations could rise to 32,000 per day by the middle of September. And while we wait for that briefing to begin, I have the pleasure of talking to Dr. Darian Sutton right here on set with me to break this all down for us. Dr. Sutton, first of all, thanks for being here. We always love to get your analysis on these things. So what do you think about this advice on the booster shots? What data do we have right now to support this idea that we should be getting boosters 8 months after our second shot?
So this right now is an effort to be proactive from what we're seeing from outside of the United States. We have reports from Israel about the possibility of increasing susceptibility after vaccination, specifically in those groups who have been vaccinated for 8 or more months ago. And so now what the CDC is attempting to do, and the FDA is trying to grapple with this information and utilize it and make clear recommendations for our future as we see that these mild diseases of breakthrough cases is slightly increasing. Although the vaccine is still protective against severe disease, we have to be proactive for the possibility of future increase of severe disease breakthroughs. So it's a goal to keep that low.
Do you think that these vaccine boosters will be modified to help protect more against the Delta variant, let's say, or other variants, the same way the flu vaccine is updated every year?
That is a great question. That research is currently ongoing, specifically with Pfizer. We don't yet have the data on that. So when and if the booster shot will be available for the general population, and especially these vulnerable populations, it will be the same shot that was given earlier in the year.
And we keep hearing second shot, second shot, second shot. 8 months after your second shot. What happens if you got the J&J vaccine? So
this is a point that we're actually focusing on, and I'm getting a lot of messages and comments about it, specifically people who have gotten Johnson & Johnson, and they say, what do I do now? And the answer is that we just don't have the information about that, and we can't act on no information. My advice is that there's no reason to believe that there's an increased level of harm if one were to get Johnson & Johnson and then to follow up with a full booster shot that involved an mRNA vaccine. But I encourage my patients to talk to their providers about what recommendations and indications are appropriate for them.
And the J&J shots also came out later, so that's going to be less of a factor, at least for a little while, for people who started getting it. Is that right? I
believe so. And we have to focus on, number one, I think the main question is those who got the J&J shot who are immune suppressed or elderly. That's the specific vulnerable population that we're focusing on. But in terms of breakthrough, we have not seen any specific difference in terms of breakthrough events with mRNA versus Johnson & Johnson vaccine.
So what do you think about the timeline of all of this? How is this all going to look once this authorization comes forward?
So it seems as though the authorization will come forward, and then CDC will make specific recommendations, possibly as early as next month. And so that likely will be in our email boxes and in our files about whether or not we should make a decision to get a booster. And it will focus on those who got vaccinated first, which includes people like me and other healthcare providers who are on the front lines, and those who are in long-term care facilities. As you know, patients in long-term care facilities represent 1% of the population, but more than 30% of hospitalizations and deaths. So that's an incredibly vulnerable population.
Now, when the original vaccine rollout started, there was a lot of confusion. People were standing on very long lines or constantly refreshing the page on their web browser to try to see if they could get an appointment. Some people didn't know if they qualified or not. So how do you think the government can go about making the rollout for this booster shot go more smoothly?
I think it will go more smoothly. I think it will go more smoothly simply because people understand the process and they've gotten it before, and now we have more avenues of access. But we do have to answer this question of equity in terms of giving this vaccine out, not just within the United States, but other low-income countries that are suffering from lack of vaccine at all. And so I think that although we need to focus on making sure that we distribute this vaccine to those who are most vulnerable, we have to realize that this is a global pandemic, and we need to do our due diligence in making sure that we're an ally to other countries in need.
Well, and it has become a bit of a contentious issue because you have some critics saying that we should be focusing on giving extra vaccines to other countries in need instead of giving boosters to our people who are already vaccinated. Other critics are saying that we should be focusing on trying to get the roughly 30% of unvaccinated Americans who are eligible, get them vaccinated instead of giving boosters to those who already are. So what do you make of those two arguments?
So my priority as a physician, as a healthcare provider and science communicator is focusing on the unvaccinated. We do know that the unvaccinated are more than 95% of the hospitalized patients, and they are the main cause of transmission. So although I think booster shots are incredibly incredibly important and valuable, we have to acknowledge the key driver of transmission, which are those who are unvaccinated. So we need to focus on that group. And then I think stepping to the most vulnerable, which are elderly and immune suppressed, and then those who have gotten their shots early on, including me and other people who are directly exposed to this virus. But we have to do that simultaneously while making sure that we address the problems outside of the United States, because after all, this is a global pandemic, and we need to address all of these issues together. So it's nuanced and complicated, but I'm sure that we can get it done.
Walk and chew gum at the same time.
Absolutely.
And once these booster shots start rolling out, do you think this is something we're going to start to need every 8 months?
That's a question that we don't have the answer to, and I think that whether or not we need a booster shot in the future beyond the month of September depends on a couple of different variables. Number one, what is the outbreak or case rate that we're seeing at that time? What are the specific groups that are having breakthrough rates? And then what is your individual susceptibility in terms of exposure and your risk of infection?
And do you know what happens if you get it before 8 months? How strict is that deadline?
I think that that deadline is put in place just as an idea, but we don't have much data around whether or not it would increase risk. But there's no reason to believe that getting an extra dose around this time period at all would increase one's risk. But the main question is, what is the exact benefit? And that's what we're trying to understand right now.
And we know, again, at this point, roughly 30% of the eligible U.S. population still is not vaccinated. For some, it might be a question of access. For others, it's a question of hesitancy. They're not sure they want this vaccine, or maybe they know that they don't. So how do you prevent this idea of needing a third shot now from making people even more hesitant to get the first two?
You know, I think that that is also a nuanced problem. As we look at the population of those who are unvaccinated, they are not monolithic. Many people have different reasons for why they have not gotten vaccinated. Some don't believe in this pandemic exists at all. Others are afraid of needles or something as simple as getting vaccinated. And others have real and present and past trauma with the medical system. So I think in addressing that issue, we need to understand why the reasons are that people are not getting vaccinated, and then look at local community leaders and trusted sources of these people who are not vaccinated and engage so that we can provide that education that these vaccines are safe and effective.
And I want to talk side effects. I know there's a few layers to that part of the conversation. So let's just start with the basic side effects that most people experience, maybe a fever, flu-like symptoms, that kind of thing. For a lot of us, those side effects happen more dramatically after the second shot. So what can we expect after a third shot?
You know, I would presume, based off of my inference and understanding of prior understanding of vaccines, such as the flu vaccine, that whatever your reaction was in your first or second shot would be similar, if not the same, in the third shot. There's no reason to believe that it would cause an increased risk of harm or symptoms. And again, those symptoms can include fever, fatigue, weakness, sometimes a moment of dizziness that you might have. But overall, the vaccine intermittent feeling that you have after getting vaccinated is very brief and short-lasting. And so I encourage patients not to be afraid of that symptoms.
And then what about the longer-term potential side effects that concerns have been voiced over the past few months, things like blood clots or myocarditis? What's your take on that when it comes to looking at a booster shot?
So when I look at that, I also understand what is my risk in this situation. So when we look at events such as myocarditis or the rare event of blood clotting disorders that we saw within the Johnson & Johnson, those risks were about 1 to 7 in a million cases. So they're incredibly rare, and they remain rare, which is fantastic. But the risk of COVID-19 is clear and present, and especially in the setting of this new, more transmissible Delta variant, that right now poses a greater risk to our health than anything else. So although we want to acknowledge that rare risk, we have to also be realistic and understand the very real risk of COVID-19.
We also still have a block of the population that is not eligible to be vaccinated. Kids 12 and under can't get any of these vaccines yet. So what's the timeline on that? When can we expect an FDA authorization for kids under 12, and when do you think that rollout will start to happen?
So that's actually being done in something called age de-escalation studies, where they're coming out with this information regarding immune susceptibility, as well as the immunogenicity and the safety and efficacy of vaccines in these age groups, for example, 12 and under. We probably won't see that data until next month, and then we probably won't see official guidelines until months later, but hopefully before the end of this calendar year. But in the meantime, while we have this understanding of how to prevent this virus, we need to make sure that we put masks on children, especially those who are unvaccinated, of course, and especially those who are indoors with other children, to decrease transmission as much as possible.
And we have heard reports of people, for example, trying to lie about their kids' age, say they're a little bit older, to try to get them a vaccine, and also people getting in and trying to get a third dose of the vaccine, in some cases succeeding, before, obviously, these boosters are even authorized. So what's your take on that?
I encourage my patients to be honest with themselves and also their providers when they're making decisions like this. I wouldn't want to expose to unnecessary risk, and also the question of what is the exact benefit. So I think if you're going to go about that route, make sure you talk to a provider so that you understand your risk and the clinical indications about getting a vaccine, and specifically to this more than 1 million people who have already gotten their third dose. I would hope that they have conversations with trusted providers so that they can understand the science, their clinical risk, and their indications for getting vaccinated.
So we know that in just a few minutes we're going to hear from the COVID-19 response team about these boosters and these new recommendations. We'll hear from President Biden a little bit later on that as well. Starting with the COVID-19 response team, what are you looking to hear from them today? What are you listening for?
I'm listening for clear guidelines. What are the groups that we're focusing on here? Are we focusing on those who are highly exposed, like myself and other ER physicians? Are we focusing on those who are just highly at risk, like elderly patients and those living in long-term care facilities? I would love to see a plan with specific guidelines so that we understand, and also a timeline, very similar to what we had in the initial rollout of these vaccines. Are we going to do this in a month progression where we have specific groups and then go through tiers, or are we just going to do all hands on deck and everyone get a vaccine? So I'm hopeful that we'll have a specific plan when we hear about these guidelines coming out today.
And I know that when the initial rollout happened, we saw healthcare workers understandably be first in line to get them. Now that hospitals are starting to get overwhelmed, do you think they have to take into account maybe staggering those availabilities so that you don't have all these healthcare workers suddenly out with these flu-like symptoms for a day or two?
Absolutely. We have to take that into understanding about the fact that when you get a vaccine, you might have symptoms that might cause you to be a day off of work. Unfortunately, in the setting of this ongoing pandemic, that really isn't afforded to us in medicine. So we have to make sure that we coordinate our schedules as physicians and other healthcare providers so that we make sure that we are on the game so that when we get to the hospital, we can treat patients as effectively as possible.
We do not want the doctors or nurses to be out sick.
Exactly, especially with these shortages that we're seeing in other parts of the world and the country.
And what are you seeing? Because I know you're there. You're an emergency room physician. You're right there on the front lines. You don't just do this on TV. Yeah. So what are you seeing right now? Because you seem to be a magnet for hotspots, at least early on in the pandemic. You were going from New York to LA. What are you seeing now?
Unfortunately, I feel like I am following this pandemic, as I spent the half of this pandemic here in New York City and now in Los Angeles, and seeing the peak of these outbreaks in both of these cities. Right now, the main issue is nursing shortages. Our nurses are exhausted. They feel underappreciated and overworked, and that is a sentiment that I've felt and heard from many nurses across the United States. And so we need to make sure that we value them, because they are not only the gatekeepers of safety, but they help us with our patients. So hopefully we'll be able to grapple with this issue as soon as possible.
Absolutely. All right, Dr. Sutton, thank you so much. Stick around, because we're going to want to talk to you after this press conference. But right now, we're going to hear from the White House COVID response team. Let's listen.
Vaccination rates. So this remains a pandemic of the unvaccinated. We know getting more people vaccinated is the best way to end this pandemic. And thanks to our relentless efforts to get more shots in arms, we are making progress. In the last 2 weeks alone, nearly 7 million Americans have rolled up their sleeves and gotten their first shot. 7 million, that's the highest 2-week total since the beginning of June. And over the past month, we've also seen a 75% increase in the average daily number of 12 to 15-year-olds getting vaccinated, particularly important as adolescents begin going back to school. And once the numbers from today are reported, we will have reached 200 million Americans with at least their first shot. 200 million Americans with at least one shot. That's a major milestone. Americans across the country are continuing to step up, do their part, and get vaccinated. We are using every lever at our disposal to fight the virus, including by ensuring state and local leaders have the tools and the resources they need to get more shots in arms and to respond to any outbreaks caused by Delta. Our COVID-19 surge response teams are a whole of government effort with experts and personnel and resources from HHS, CDC, FEMA, the Department of Defense, and the Department of Veterans Affairs. These surge response teams are now working with 16 states to address their particular needs, from deploying hundreds of personnel to provide medical care, to standing up free testing sites, to surging critical assets like ventilators and ambulance to strained health systems, to getting shots in arms, including through the use of mobile clinics, to sending and supporting the use of life-saving treatments. And we will continue working closely with states to do all that we can and to match resources to their needs. Just yesterday, President Biden directed FEMA to continue fully reimbursing states, tribes, and territories for all eligible COVID-19 emergency response costs through the end of the calendar year, a 3-month extension of the order he signed on his first full day in office. Importantly, this maintains 100% federal reimbursement for state deployments of National Guard personnel for critical COVID-19 missions. President Biden committed to the American people that he would do everything in his power to end this pandemic. And from his first day in office, the president has marshaled a wartime effort to do exactly that. We've been preparing for every scenario, including the potential need for vaccine booster shots. Our approach on booster shots is simple, and it's consistent with our approach on every other front of this war. Be guided by the science, and always, always stay one step ahead of the virus. Now let me turn it to Dr. Murphy to discuss our booster plans, and then Drs. Walensky and Fauci to discuss the science behind the plan. Over to you, Dr. Murphy.
Well, thanks, Jeff, and it's good to be with all of you again today. Today, I want to update you about where we are regarding boosters for fully vaccinated individuals. Our top priority has always been protecting people and their families with from COVID-19. And we have been fortunate to have safe, effective vaccines that offer outstanding protection against the worst outcomes of this virus: severe disease, hospitalization, and death. The COVID-19 vaccines that are authorized in the United States have been remarkably effective, even against the widespread Delta variant. But we know that even highly effective vaccines become less effective over time. Our goal has been to determine when that time might come for the COVID-19 vaccines so we can make a plan to take proactive steps to extend and enhance the protection the vaccines are giving us. Having reviewed the most current data, it is now our clinical judgment that the time to lay out a plan for COVID-19 boosters is now. Recent data makes clear that protection against mild and moderate disease has decreased over time. This is likely due to both waning immunity and the strength of the widespread Delta variant. Even though this new data affirms that vaccine protection remains high against the worst outcomes of COVID, we are concerned that this pattern of decline we are seeing will continue in the months ahead, which could lead to reduced protection against severe disease, hospitalization, and death. That is why today we are announcing our plan to stay ahead of this virus by being prepared to offer COVID-19 booster shots to fully vaccinated adults 18 years and older. They would be eligible for their booster shot 8 months after receiving their second dose of the Pfizer or Moderna mRNA vaccines. We plan to start this program the week of September 20th, 2021. I want to be very clear. This plan is pending the FDA conducting an independent evaluation of the safety and effectiveness of a third dose of the Pfizer and Moderna mRNA vaccines, and the CDC's Advisory Committee on Immunization Practices issuing booster dose recommendations based on a thorough review of the evidence. The plan ensures that people who were fully vaccinated earliest in the vaccination rollout will be eligible for a booster first. This includes our most vulnerable populations, like our healthcare providers, nursing home residents, and other seniors. We will also begin delivering booster shots directly to residents of long-term care facilities. For people who received the Johnson & Johnson vaccine, we anticipate vaccine boosters will likely be needed. The J&J vaccine was not administered in the US until March of 2021, and we expect more data on J&J in the coming weeks. With those data in hand, we will keep the public informed with a timely plan for J&J booster shots. I want to emphasize that this decision was not made lightly. It was made with careful consideration by the top medical and public health experts in the Department of Health and Human Services. It was informed by data, thoughtful analysis, and by our collective years of experience addressing illness and epidemics. As always, we will continue to follow the science on a daily basis, and will take whatever steps are necessary to protect our nation from COVID-19. This plan to administer booster doses does not change our commitment to vaccinating those who are not yet vaccinated here in the US and around the world. The overwhelming majority of hospitalizations and death continue to occur among the unvaccinated. We will continue to ramp up efforts to increase vaccinations here at home and to ensure people have accurate information about vaccines and access to vaccinations. We will also continue to expand our efforts to increase the supply of vaccines for other countries, building on the over 600 million doses we've already committed to donate globally. We understand well that global pandemics require a global response and strong leadership, and we will not stop until America and the world are vaccinated against COVID-19. I'm speaking to you today as your Surgeon General, but most importantly as a fellow American who has felt the pain of losing family members to this disease and who hears each day the stories of people whose lives have been upended and forever altered by COVID-19. The brave doctors and nurses in our hospitals, the teachers working to get our kids back to school, and the frontline workers who have put themselves on the line to make sure we can get groceries and supplies. We all want this pandemic to be over. And right now, our quickest path to getting COVID-19 under control, once and for all, is getting vaccines to those who need them as quickly as possible. So here's what you need to know. If you are fully vaccinated, you still have a high degree of protection from the worst outcomes of COVID-19, severe disease, hospitalization, and death. So we are not recommending that you go out and get a booster today. Instead, starting the week of September 20th, fully vaccinated adults could begin getting their booster shots 8 months after their second shot of an mRNA vaccine. And finally, all of us must do everything we can to protect our communities from COVID-19. That means encouraging our family and friends, our patients and students, our coworkers and neighbors to get vaccinated. That is our path to ending this pandemic. I'll now turn it over to Dr. Walensky, who will walk us through some of the data that help inform our decision to take action now.
Good morning, Doctor. Good morning, everyone. And as Dr. Murthy mentioned, I want to provide an update on vaccine effectiveness. Today, we are releasing 3 articles in MMWR with data I will now describe that are helping to inform our booster plans. Recognizing that for most vaccines, there is a reduction in protection over time, we have been analyzing the data closely from a number of cohorts in the United States and around the world to understand how long protection from the initial COVID-19 vaccine series will last. Examining numerous cohorts through the end of July and early August, 3 points are now very clear. First, vaccine-induced protection against SARS-CoV-2 infection begins to decrease over time. Second, vaccine effectiveness against severe disease, hospitalization, and death remains relatively high. And third, vaccine effectiveness is generally decreased against the Delta variant. So let's jump into the data. On this slide, you will see 2 studies, one from New York and one an analysis of data from the Mayo Clinic. From May 3rd through July 25th, New York examined COVID-19 tests and linked them to individuals' vaccination status based on the state's vaccine records. This allowed New York to study vaccine effectiveness against infection over time for more than 10 million New Yorkers of all ages. Vaccine effectiveness in May, early during the vaccine rollout in the state, was 92%. In the later months, further from vaccination, vaccine effectiveness declined to 80%. These data will be published in the MMWR today. The Mayo Clinic analysis looked at vaccine effectiveness for both the Pfizer and Moderna vaccines among over 80,000 vaccinated and unvaccinated individuals across all age groups with data through July 16th. Like we saw in the New York data, vaccine effectiveness against infection declined over time. In this case, from 76% to 42% for those who received the Pfizer vaccine, and from 86% to 76% for those who received the Moderna vaccine. These data are currently available on a preprint server. Today, CDC will also publish data from our National Healthcare Safety Network, a nursing home cohort where we analyzed more than 85,000 weekly reports from more than 14,900 facilities. Weekly COVID-19 case counts were used to evaluate vaccine effectiveness over time. These data demonstrate that vaccine effectiveness declined over time from 75% in March to 53% as recently as August 1st, 2021. This represents a substantial decline in vaccine effectiveness against infection among those who are most vulnerable, including during months where Delta was the predominant circulating variant. Taken together, you can see that while the exact percentage of vaccine effectiveness over time differs depending on the cohort and setting studied, the data consistently demonstrate a reduction of vaccine effectiveness against infection over time. Importantly, though, despite waning vaccine effectiveness against infection, data analyzed through July continue to demonstrate a stable and highly effective protection against severe illness and hospitalization for people who are vaccinated. Included in the same reports described before, data from New York State and Mayo Clinic also show that vaccine effectiveness against hospitalization remains relatively high, both over time and during periods when the Delta variant was surging. CDC will also publish today in the MMWR data from the Ivy network, which examines data over 3,000 adults admitted to 21 hospitals across 18 states between March and mid-July. This report compares vaccine effectiveness against hospitalizations early after vaccination, within 2 to 12 weeks, and later after vaccination, between 13 and 24 weeks, and found that vaccine effectiveness against hospitalization remained high. However, in this study, only about 7% of samples sequenced were the Delta variant. Taken together, these data confirm that while protection against infection may decrease over time, protection against severe disease and hospitalization is currently holding up pretty well. As we make decisions about boosters, though, we also have to look at vaccine effectiveness in the specific context of the Delta variant. Preliminary data through August 6th from 2 of our vaccine effectiveness cohort studies that include more than 4,000 healthcare personnel, first responders, and other frontline workers in 8 locations across the country show waning effectiveness against symptomatic and asymptomatic infection in the context of the Delta variant, from 92% prior to Delta to 64% with Delta. Notably, this analysis did not show difference over time, which suggests effectiveness is also decreased against Delta, independent of when you were vaccinated. These data suggest full vaccination in the context of the Delta variant may be correlated with less protection against SARS-CoV-2 infection than against prior variants. To be clear, our top priority is to save lives and prevent severe infections. The data we will publish today and next week demonstrate that vaccine effectiveness against SARS-CoV-2 infection is waning. And even though our vaccines are currently working well to prevent hospitalizations, we are seeing concerning evidence of waning vaccine effectiveness over time and against the Delta variant. Additionally, reports from our international colleagues, including Israel, suggest increased risk of severe disease amongst those vaccinated early. Given this body of evidence, we are concerned that the current strong protection against severe infection, hospitalization, and death could decrease in the months ahead, especially among those who are at higher risk or who were vaccinated earlier during the phases of our vaccination rollout. In the context of these concerns, we are planning for Americans to receive booster shots starting next month to maximize vaccine-induced protection. Our plan is to protect the American people and to stay ahead of this virus. Before I turn things over to Dr. Fauci to share the immunologic data informing our decisions, I want to emphasize one final thing. Our vaccines continue to offer the best protection against severe COVID illness. While we are still learning about how these vaccines perform over time and how long they will last against emerging variants, one thing is very clear. Getting vaccinated can keep you out of the hospital. Getting vaccinated can save your life. In areas with low vaccination coverage, we continue to hear far too many heartbreaking stories of people who did not get vaccinated, only then to get severe COVID-19. In these areas, the data are showing us that the more people who are in the hospital, and tragically, more people are dying of COVID-19. We are currently averaging over 500 COVID-19 deaths per day, and these remain largely preventable. If you are still unvaccinated, please get vaccinated. The single best action you can take to protect yourself and others is to simply get vaccinated in the first place. And now I will turn things over to Dr. Fauci.
Thank you very much, Dr. Walensky. What I'd like to do over the next couple of minutes is provide you with the immunological basis that would support a third booster mRNA immunization. I will make 4 points and show you representative data from each of these. First, antibody levels decline over time. Second, higher levels of antibody are associated with higher levels of efficacy of the vaccine. Third, higher levels of antibody may be required to protect against the problematic Delta variant. And finally, a booster mRNA immunization increases antibody titers by at least 10-fold and likely much more. Next slide. So let's take the first concept, that antibody levels decline over time, in this case, following 2 mRNA immunizations, and that's regardless of the variant. So if you look at the horizontal axis, at day 29 is when you get your second shot. You can see the level of antibodies go up at 43 days, but look what happens at 119 and 209 days. Regardless of the variant involved, the antibody levels against those variants decline over time. Next slide. Next concept, that higher levels of antibody are associated with higher levels of vaccine efficacy. This is often referred to as an immune correlate. And this is a paper recently published in a preprint server. And what it shows is that a model of vaccine efficacy, in this case, based on the Moderna phase 3 trial, showed that 4 weeks after the second dose, that what you have is a serum neutralization titer of 1 to 100, which goes up from the vertical red line. That gives you an efficacy of 91%. But if you look at the dark black line going from left to right, as you go further up, you get a higher degree of efficacy. So the higher the neutralization titer, the higher degree of efficacy of the vaccine in this model. Next slide. Third issue, higher levels of antibody may be required to protect against Delta. And I'm showing you data now, both from Moderna on the left, and a paper in the New England Journal has very similar data from Pfizer. So if you look at the left panel, what you're measuring is neutralization titer after 2 doses of the immunization. And the open circles are the same people as in the pink circles. And you're looking at the fact that the neutralization titer required to neutralize the standard prototype D614G, which was the original variant, is clearly the titer is much lower. As you see, it all goes down in pink. when you're dealing with Delta. Next slide. The next concept, and that gets to the booster. The booster mRNA immunization increases antibody titers by at least tenfold. These are data from Moderna, but Pfizer has announced very similar data. The bottom line is, if you look first at the left panel, the first column is looking at the antibody titers just before the third dose. And then 15 days after the third dose is shown right next to it that says D15. As you can see, a remarkable increase in titers against the 614G, the B1351, the P1, and in the Pfizer data, which you expect would be very, very similar to the Moderna, it was also against the Delta variant. So you get a dramatic increase in antibody titers when you do a third immunization dose. Last slide. And so in summary, the current immunological data that indicate that antibody levels decline over time, higher levels of antibody are associated with a higher level of efficacy, higher levels of antibody may be required to protect against Delta, and as I showed you on this former slide, a booster mRNA immunization increases antibody titers by multiple fold. All of this support the use of a third booster mRNA immunization to increase the overall level of protection. We'll go back to you now, Jeff.
Thank you, Drs. Murphy, Fauci, and Walensky. I want to be clear, the President's whole of government vaccination effort is ready to get every American who needs one a booster shot. Pending FDA and ACIP approvals, boosters will be available starting the week of September 20th. The plan is for the rule to be simple. Get your booster shot 8 months after you got your second shot, I apologize. So if you got your second shot on February 1st, you can get a booster starting on October 1st. If you got your second shot on March 12th, you can get your booster starting on November 12th, and so on. Thanks to the aggressive actions we have taken to establish our vaccination program, it will be just as easy and convenient to get a booster shot as it is to get a first shot today. We have enough vaccine supply for every American. And you'll be able to get a booster at roughly 80,000 places across the country, including over 40,000 local pharmacies. In fact, 90% of Americans have a vaccine site within 5 miles of where they live. And importantly, boosters will be free, regardless of immigration or health insurance status. No ID or insurance required. So the bottom line is that we are prepared for boosters, and we will hit the ground running. In the weeks ahead, we'll continue working closely with states, healthcare providers, pharmacies, and national and community-based organizations to ensure Americans know they should get a booster shot 8 months after their second shot. And we will be laser focused on getting boosters to long-term care facilities to make sure residents and staff get their shots and are safe and protected. Importantly, as we continue to vaccinate Americans, we will maintain our focus abroad, as we know this virus knows no borders. We have already shipped more than 115 million vaccine doses to 80 different countries. More vaccine doses donated than all the other countries in the world combined. And just this week, we started shipping the 500 million Pfizer doses that the U.S. pledged to purchase and donate to 100 low and lower middle income countries in need. And in the coming weeks and months, we will do even more to lead the global vaccination efforts. accelerating our work to build vaccine manufacturing and production capacity, both here in the U.S. and in other countries. Our wartime effort will continue doing everything we can to get even more people vaccinated, both here at home and around the world. We can and must do both at the same time, because that's what it's going to take to end this pandemic. And we will not stop until we get the job done. With that, let's open it up for questions.
Thanks, Jeff. And as a reminder, please keep your question to one question. There are many today. First, let's go to Lev Thatcher at Stat News.
Hi, folks. Thanks, as always, for doing the briefing. This is a Mike Ryan quote from a WHO briefing earlier today about booster shots. If we think about this in terms of an analogy, we're planning to hand out extra life jackets to people who already have life jackets. And I'm curious, I know you've emphasized, all of you, that this is a false choice, vaccinating Americans versus vaccinating the rest of the world, but could you explain how there isn't finite vaccine capacity and how booster shots for Americans does not at this moment come at the expense of first vaccine or second vaccine doses for folks elsewhere in the world?
So let me go first, and then Dr. Murthy, if you want to add anything. Look, to end this pandemic, we have to protect the American people, and we have to continue to do more and more to vaccinate the world. Both are critical, and we're already proving that we can protect our own people here at home as we help others. Just to give you some data here, in the months of June and July, the U.S. administered 50 million shots here in the United States, and we shipped more than 100 million to other countries. As I said, the 115 million doses that we've already donated is more than all the other countries combined. And during the coming months, when we talk about booster shots, we expect to give about 100 million boosters in the United States. And at the same time, we will be donating more than 200 million, twice that number, additional doses to other countries, on our way to donating more than 600 million vaccines. So we are continuing to serve, as the president has said, as an arsenal for vaccines for the world. And you'll see us do more and more. This builds on our support of the TRIPS waiver, our commitment to COVAX, where we are the largest contributor, the Quad partnership, which we helped to establish, which is on track to produce at least 1 billion doses of COVID vaccine in India for the Asia region by the end of 2022, and our work to support vaccine manufacturing in Africa by providing financing to a South African business to bolster manufacturing capacity to produce more than 500 million doses. And we're just going to keep going and going and going. So this is a situation where we're going to do both. We're going to both protect the American people, and we're going to do more and more to help vaccinate the world. Dr. Murthy?
Well, thanks, Jeff. And Lev, good to hear your question. Appreciate it. Look, I do not accept the idea that we have to choose between America and the world. We clearly see our responsibility to both, and that we've got to do everything we can to protect people here at home while recognizing that tamping down the pandemic across the world and getting people vaccinated is going to be key to preventing the rise of future variants. We know that, we see that clearly, and we believe we have to work on both fronts as we have been. But Lev, when we see data that is giving us essentially indications that protection is starting to diminish in terms of mild, moderate disease, when we recognize that if this trajectory continues, that people who are well protected today may see more vulnerability in the future, we have to act. The science tells us that, our clinical judgment tells us that, and that was a collective decision of the top public health and medical experts in this administration. So again, we will do everything possible to protect people in our country. That's why we're announcing this booster plan. But we will also continue to accelerate our efforts to vaccinate the rest of the world. We take that responsibility very seriously.
Next question, please.
Cheyenne Haslett at ABC News.
Hi, thanks for taking my question. How realistic is that September 20th launch date, given that we haven't seen the official EUA request from Pfizer or Moderna yet?
That is the date that we're working toward, and as we've said, that is obviously pending both the FDA's approval and the ACIP's recommendation. So that is the date that we are prepared for at the beginning of the week of September 20th. Next
Jeremy,
question.
CNN.
Hey there, thanks for taking my question. First of all, why did you guys decide not to limit this to older and more at-risk Americans and simply say that all vaccinated people will need a booster shot after 8 months? And secondly, you say in this statement that the protection against severe disease, hospitalization, and death could diminish. How certain are you about that? And are you saying over time that you do not believe these vaccines will continue to be highly effective at preventing hospitalization and death? Thanks.
Let's start with you, Dr. Murthy.
Well, thanks, Jeremy, for that question. Look, first I would say that when we look at the data, we see a reduction in protection against mild to moderate disease across age groups. And that was an important part of why we made this recommendation for all adults. We want to protect all adults in our country from the worst effects of COVID-19. But our plan does prioritize the most vulnerable. If you look at how we began vaccinating people, Jeremy, over at the beginning of the vaccination effort, we prioritized healthcare workers, long-term care facility residents, and the elderly. And those are exactly the same populations that we will be starting with. So we do prioritize the most vulnerable. We think that's going to be essential, in our goal to ultimately to protect the country and save the most lives.
Next question.
So again, we're listening to the White House COVID-19 response team. They've just issued a recommendation that Americans 18 and up start receiving booster shots of the COVID-19 vaccine 8 months after receiving their second shot of the Moderna or Pfizer vaccines. They are still evaluating what will happen with the Johnson & Johnson vaccine, still waiting on more data to come out on that. But I want to bring in Dr. Darian Sutton again here with me to break down some of what we heard today. Dr. Sutton, it sounds like the main data that this is based on is this concern that in general, vaccines wane over time. That's a normal process. But what they're seeing in this data, specifically to these COVID-19 vaccines, is that they are waning over time, and you get a decreased level of immunity toward the virus and toward specifically serious outcomes toward the virus over time. So they're now saying this 8-month timeline is when they want people to start getting booster shots. What do you make of that?
So I think that it's coming off of a lot of information where they're doing their best to take this information and utilize it to protect as many people as possible in the future. As you stated, we're seeing that their antibody responses of patients that we're studying is slightly waning over time, and we're seeing a slight uptick in those mild or moderate diseases or breakthrough cases of those who have been vaccinated and then get COVID-19 infections. But luckily, we're still seeing that protective effect against hospitalizations and deaths. So what they're saying is that in the setting of this ongoing viral pandemic with this more transmissible Delta variant, we want to protect against the possibility of that mild uptick of mild cases progressing into the uptick of severe cases. And in doing that, the best way to do that is to vaccinate the most vulnerable and, of course, those who have been more than 8 months out of their most recent second dose.
And they seem to want to hammer the point home that the vaccines are still currently doing a good job of protecting against severe disease. They're just trying to follow the science and get ahead of this before it becomes a problem and people who are vaccinated start getting sick with severe disease or death.
That is the most important point to understand, is that your vaccine, if you have it, it's still protecting you, and hopefully that provides some calm to people out there looking at this with anxious feelings. But again, our goal is to act ahead of time and try to predict what's going to happen in the future and protect people from possible harm. And that decision is why we've come up with this idea of getting vaccinated more than 8 months out of your second dose.
And when they talk about things like the effectiveness is waning or the efficacy is waning, what do they mean by that?
Great question. So efficacy is something that is studied within a specific scientific when you're studying in science and you're doing research, efficacy is in that controlled environment. It's a stable number. Effectiveness is kind of how the vaccine does over time, and it's dependent on the environment that the vaccine is acting in. For example, now that we have this more transmissible variant, you will likely see effectiveness wane. But also, effectiveness is a variable that is a comparison of those who are vaccinated and those who are unvaccinated. So as you have more people who are getting natural infections and getting natural immunity, you're going to see a shift in that number, and that's what's going to bring that efficacy down. So effectiveness. So we'll always see a trend that effectiveness slightly decreases after the rollout of a vaccine.
So efficacy is what happens in the lab. Effectiveness is what happens in real life.
Exactly. And it doesn't mean that it's your individual susceptibility. And that's also what people take into play. As they see that number is 60% or 65%, and then they take that as their individual risk, but it's not the same thing.
Wait, I need you to explain that then, because that's me. I see, it's 90% effective or it's 60% effective, and I think, okay, I am now 90% protected or 60% protected.
And that's our immediate minds as humans. We want to apply that number and apply it to ourselves, but we're looking at a population standard of a number, how it's doing overall in the community, and everyone has their individual risks, whether that be someone who's elderly or immune suppressed or pregnant. Everyone has their individual risk, and that is what we discuss in our patient-doctor relationships when we're having conversations.
And it probably depends on your community levels too, right?
Exactly the point.
Now, you said while the press conference was going on that there's no real test for immunity to COVID-19 the way there is for some other diseases. Can you explain that?
Yeah, so we have certain tests for immunity, for example, diseases like measles and hepatitis. We can test the patient and understand whether or not they are immune. We don't yet have that technology or that information for COVID-19. And by that, I mean we understand that antibodies are associated possibly to susceptibility. And when we see antibody levels wane, we get concerned that that might increase the risk to that patient of getting infected. But we don't yet know exactly how many antibodies someone needs in order to be fully protected, or maybe it's another factor in the immune response that we just have not yet found. And so that's information that's still ongoing and we don't yet have.
And we heard Dr. Walensky talk about how the vaccine does seem to be a little less effective against the Delta variant, but then we also heard Dr. Fauci talking about a boost in antibodies could help fight off the Delta variant, and that's what they were seeing soon after vaccinations and what they're hoping to see with a booster shot. So when you put that together, how do these boosters help to fight against the Delta variant and future variants?
Great question. So when we get infected by the natural infection or we get vaccinated, our immune response creates a complex level of immunity, not just in a specific antibody that targets the spike protein on COVID-19, but a variability of our immune response develops, and that kind of concentrates over time and forms memory cells. And so our goal with these vaccines is boosting that effect and creating a variability in our immune response that protects us not just against COVID-19 and the Delta variant, but the possibility of future variants that will likely develop in the future.
Well, and when it comes to those variants, the Delta variant, for example, it wasn't created here, it was created in India. So this is also leading to a larger conversation of, should we be giving booster shots or should we be giving more vaccines to other countries that need more vaccinations to try to prevent the global development of these variants, which we know they travel very easily.
We understand that in low vaccination rate communities, states, and countries, that is where we have high transmission. And high transmission allows the opportunity for new variants to develop. And so we need to do our best to do both, as what was stated at the end of that briefing. We need to make sure that we protect the people here within this country, but we also need to do our due diligence and give this vaccine out to the countries in need. As we know, low-income countries, unfortunately, have less than 5% of people who are vaccinated. And we just cannot allow that to keep going because it will allow more transmission and possibly threaten all of the work that we've done.
And I'm sure a lot of people at home are watching this and thinking, listen, I got the first shot, I got my second shot, I did as I was told, I'm protected, right?
Yeah.
And I know you have this fun rain jacket analogy. Can you just explain how that process works as a layered approach?
Absolutely. So I think of my vaccine as a raincoat, and I think of COVID-19 and the experiences of outbreaks as rainy weather. If you know that the weather is going to be mild, maybe a slight drizzle, you'll wear your raincoat and feel comfortable. You'll walk outside without a mask. But if you know that there's a high level of outbreak and transmission and disease around you, you're likely, for example, a heavy rainy day, you're going to grab more gear. You're going to grab an umbrella, and in this case, a mask. And so I always help patients understand, use your vaccine as a supplement to protection, and when you're entering to a level of high risk, increase that level of protection by masking and distancing when possible.
All right. The umbrella, the raincoat, the hat, the whole 9 yards if you need it. Dr. Sutton, it's always great to have you. Thanks so much.
Thank you.
And coming up, the race to evacuate Afghanistan is on, with tens of thousands desperately trying to get out. Now the White House is facing criticism as many wonder how they're supposed to get through Taliban checkpoints and actually reach the airport. Hear the latest message from the U.S. to those Americans when we return. Welcome back. You're looking at the Kabul airport, where U.S. troops are scrambling to fly Americans and allies out of the country. At least 3,200 diplomats and civilians have been evacuated from Afghanistan on military flights so far. But anyone trying to get to the airport has to pass through Taliban checkpoints, and not everyone's getting through. Meanwhile, the Taliban is promising a general amnesty for all U.S. allies in Afghanistan. One senior leader saying now is the time to forgive and that they are not seeking revenge. But the U.S., the EU, and at least 19 other countries now say in a joint statement they are, quote, deeply worried about Afghan women and girls and their rights and freedoms. Our senior foreign correspondent Ian Pannell is in Kabul with the latest. Hi, Ian.
Diane, that Taliban press conference was totally surreal and bizarre. This time last week, we were talking about the Taliban having taken 9 provincial capitals and how serious the situation was looking on the ground. Today, they're holding press conferences. They're in the process of establishing a government and trying to run the country. It was odd because you saw the Taliban spokesman come down the stairs to a sort of hushed auditorium, which was very first 21st century, but a lot of the guys coming down the stairs there have views which are centuries old. This was really a PR offensive by the Taliban to try and convince us that they are going to have much better views on women, that they're going to treat the civilians well. There's a general amnesty. They said that women are going to be able to take their place in work, in education, according to Islam, without providing any specifics of what that would mean. Someone asked a question, will women be forced to wear burqas? Will men be forced to grow beards, as was the case the last time they were in power? He said, well, we haven't quite decided that yet. So look, the proof of the pudding is going to be in the eating. People are rightly skeptical because the Taliban's record is terrible. They have been seen torturing, executing prisoners, their enemies. They've been seen, I mean, the last time they were in power, women had 0 rights. Women couldn't even leave the house without being accompanied by a brother or a father, a male member of the family. They weren't allowed to go to most places of work. They certainly weren't allowed into higher education or into high school. So they have a lot to prove. People are skeptical, and there is really an air of sadness and darkness here in Kabul. Even just anecdotally, here in the hotel, the young Hazara women who were working on reception, who I was chatting to, because I've been here a few times, they're asking me how I am, how is the family, we exchange pleasantries. Today, they've gone. The music that plays in the lobby has stopped. And so I think people are very wary exactly what the Taliban are going to do, whether actually we're just going to be back at least 20 years, and for women, back 200 years. We've just been down to the airport this morning, and I have to say, although we're seeing a fairly orderly system now in place inside the military compound, which is controlled by the Americans, you only have to step 5 yards outside there to see the hundreds, the thousands of people desperately clamoring to try and get through that Taliban checkpoint and get to those flights. Many of them, of course, have legitimate claims. They are eligible for flights, but the Taliban aren't letting them through, and their response on the ground is brutal. It's offensive. They're threatening. They're firing automatic weapons over the heads of the crowd repeatedly. I mean, we had this period of 1.5 minutes of constant gunfire. I almost thought there was a gun battle going on, but they were just firing over the crowds to try and push them back. They're using sticks to beat people. They're pointing guns in people's faces. So this is not orderly by any stretch of the imagination. It's desperate, and people are clutching papers in little plastic folders, thrusting them towards us like we can assist them to get through. They're desperate for anyone to help them, and there isn't a system in place. The Americans say that they're talking to the Taliban. Well, that may well be the case right at the gate, but there's no system to get the Afghans or the Americans, who are now entitled to get on those flights from their homes to the airport. The U.S. State Department has said very clearly they have to make their own way there. Well, I can tell you, as a seasoned journalist, it was really scary down there, and we were able to jump in our vehicles and get out of there. For the Afghans, it's truly terrifying. Diane.
All right, Ian Panel in Kabul. Ian, stay safe. Thank you. And a programming note for you. President Biden will sit down with George Stephanopoulos at the White House tonight for his first interview since the U.S. withdrawal from Afghanistan in an ABC News exclusive. Tune in tonight right here on ABC News Live. Meanwhile, search and rescue teams in Haiti are racing to find survivors trapped in the rubble after that catastrophic earthquake. More and more injured people are showing up at hospitals there, many of which were also damaged. Our Matt Gutman is on the ground in Haiti with the latest. Good morning, Matt.
Hey, good morning, Diane. We are at the Ofatma Hospital in Lakai. This is really one of the few functioning hospitals here, although the building itself is structurally unsound. The operating room is essentially cracked open, so they've emptied out the rooms and whatever equipment they could take, and it's literally in the central courtyard behind me. That's what the doctors and administrators tell us. Their patients out there, that's where they're doing surgery as well, and they are desperately short of supplies. Sutures, IV, blood. They don't have latex gloves. There's no electricity or running water here, so it's hard to sanitize equipment. That's one of the reasons they have been medevacing so many patients out of here to Port-au-Prince to try to get them better medical care, because if you have a compound fracture of any kind, they simply can't treat you. And some of the medics in here tell me that if someone has a compound fracture, they could bleed out, and there's literally nothing they can do for them here. That as all over the countryside here, especially in the mountains, there are villages that are almost completely destroyed. People are hungry, people are thirsty, and they're asking where the help is. We've spent a lot of time out there, and we have not seen much in the way of Haitian aid from the federal government or state or local aid or international aid at this point, although we are hearing it is coming in with some size and scale at this point. But those people are desperate and they're waiting. Diane.
All right, Matt Gutman in Lakai, Haiti. Matt, thank you. And that does it for this newscast. I'm Diane Macedo. Thanks for joining us. And remember, ABC News Live is here for you all day with the latest news, context, and analysis. Stay safe.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.